Hey guys, again, Dr. Carpenter here, just talking about our exam and the things that we look for. And again, we look for a subluxation and the 5 components of a subluxation. The third component of a subluxation is going to be nerve interference or nerve irritation. One of the ways that we measure nerve irritation here in the office is through the use of what's called a nervoscope. This is a very sensitive unit. Actually, I'll turn that on. I'll show you kind of how that works. But you can look at the needle here. If I put my finger here, you'll see the needle swing to the right. If we do it on the left, you'll see it swing back to the left. It's a very, very sensitive measurement of heat, but in your spine, every pair of nerves that come out, there's also a blood vessel that comes out adjacent to that nerve that feeds the skin in our back. And if there's any kind of nerve interference, we're going to see a discrepancy from the left and the right side of your spine, and that could indicate that we might have some nerve interference. It's a fantastic tool. It helps us dial in where the problem is at. It's not an end-all be-all, but just an assessment tool. When we talk about the compression or irritation to a nerve, one of the things that we're going to affect the myotones, we're going to affect the muscle. And when the nerve affects the muscle, it can do a couple of different things. It is responsible for how a muscle contracts, but it also is responsible for like spasms and discomforts in muscles in that way. So if we were to roll over with the scan on L5 and if we had a reading, these are the muscles in the legs that we could have problems with because of that. If we found a reading at C1, that could be in the part of the neck muscles and even into the face. C5, C6, this could be more down in your arms, chest areas, back areas, and that sort of thing. If we talk about the other component of nerve irritation is going to be what actually feeds our organs. So if we ran the scan over, let's say, your L2 area, then your large intestine and bladder could be infected. If we run the scan over, let's say, T1, T2, then your heart can be affected. If we're at T9, your adrenal glands could be affected. If you're at L5, S1, this could be your large intestine, your sexual organs, and those areas can certainly be affected. So when we talk about nerve irritation, there's really 3 components. There's the motor component that feeds the muscle. It's responsible for, contraction of the muscle or weakness of the muscle. And then there is also the autonomic part of that, and that's what feeds our organs. We want to make a good check on that and a good scan on that, and then that kind of lets us know where we need to look specifically on your x-rays for why we might be having those nerve irritations. Again, if you're interested in scheduling an exam with us, just click on our special. Again, a great way to get in touch with us. We look forward to seeing you. Have a great day.